thank you for giving me the chance to present my data today. So indeed, my name is Driessen, and I'm a PhD candidate at the Vascular Medicine Department of the Amsterdam UMC. And today I'd like to tell you something about the AwareNASH project and survey specific. So the AwareNASH project was part of a learning platform program with the ultimate goal to create awareness and for the prompt diagnosis of NAFLD and investigate this. It was led by an international team of NAFLD researchers. And of course, the first question is, why is this necessary? Well, it was mentioned already several times these few days. This study in specific also, but the policy index study by Lazarus et al. Showed that none of the countries surveyed worldwide was ready for the increasing NAFLD burden. And of course, as Dutch, I was interested in where the Netherlands were, which is somewhere around here. So, like I said before, this is a work in progress. So we are implementing a guideline, we are implementing care paths. So I hope we will be a little bit up quite soon. So back to the survey, we did a survey on NAFLD awareness among healthcare workers in specific in the cardiometabolic field, and this was disseminated via several collaborating organizations and networks. We did a total of 21 questions in 3 different domains, and as you can see, we had both multiple choice questions and Likert scale questions to determine several factors. We had a total of 613 respondents from 88 countries worldwide, but it is important to note that most of the respondents came from Europe. And important to note that it would have been really interesting if we could compare results between the different regions, but we saw a large heterogeneity in the amount of specialisms per region. So for instance, Europe had way more cardiologists. So we did see differences, but it was hard to draw conclusions from them. When looking at the different professions of the respondents, we saw that 80% were physicians. So in most of our analyses, we did focus on the physicians because we could draw better conclusions from them. And when looking at the physicians in which healthcare setting they worked, they were mostly hospital-based, like a third in academic hospital, a third in public hospitals, some in private hospitals. And again, like with the regions, there was a large heterogeneity in the spread of specialties among the hospital settings. So it was hard to compare in between those. It's important to note that the physicians were able to indicate multiple affiliations or specialties. So there were some who did, which made it hard sometimes to compare between the different specialties if we included them. So whenever we wanted to compare between specialties, we excluded those from the analyses, which left us with several groups like GPs, internists, cardiologists, and we grouped gastroenterologists and hepatologists together to be able to compare between the groups. And I think one of the most important results was when we asked the physicians about their estimate of prevalence of NAFLD. And as you can see, the only correct answer is still an underestimation, only 20%. As you can see, about a third in physicians was able to indicate the correct prevalence estimate. And even the GE specialists were only a little bit over half able to indicate it correctly. You can see that the specialties we had the answers most close together were not significantly different. But I think that the trend we see is the most important thing to realize, GE specialists going down to cardiologists, because we saw that coming back several times in other questions looking at the views and attitudes for NAFLD. So when asked about their confidence in diagnosis, confidence in management, familiarity with signs and symptoms, familiarity with criteria, we saw this same trend consistently. And when we asked the physicians about what they thought were possible treatment strategies for NAFLD, we were glad to see that most of them did recognize weight loss and exercise as treatment strategies. But again, you saw a large discrepancy when looking at other treatment options. So bariatric surgery was mentioned often by GE specialists, but way less often by other specialists. Going on further on the treatment strategies, when looking at when asked physicians about the difficulty in providing lifestyle recommendations, most of them, even though they did know that it is important, indicated that they found it difficult to provide lifestyle recommendations, even though there are specific guidelines for that. And even dietitians and nutritionists indicated quite often that they had problems with that. So that might be something to look into. And I think one of the more important questions as well was when we asked physicians what were reasons that we currently do not screen for NAFLD that often. And it was clear that awareness was the most important factor. But then when looking at the other answers, there was a discrepancy where you see that the GE specialist thought that the second most important reason was the lack of treatments, while actually the GPs and cardiologists say that the suboptimal diagnostic methods is something that they think that should be given more attention, and we already have that, of course, so that's something we might focus on later. So concluding from that, I think we saw in this study that there is an underestimation of prevalence. This is, of course, in line with other studies that have been done looking at the physician's knowledge. What I think was great was that we could give some more info on the views and attitudes of physicians, and especially in GPs and especially cardiologists which have not been surveyed that well before in the case of NAFLD. And looking closer at the answers of the GPs and cardiologists, of course, lack of awareness was the thing they mentioned most often, but the diagnostic methods, it's something we can educate them on, and they really ask for tools of lifestyle advice. So what we would recommend is that as specialists in NAFLD care, GE specialists could take a role in educating their fellow physicians. And I think this is not just bluntly top-down giving them information, but we should include them in management of the disease, and also involve them in the multidisciplinary guidelines to, well, of course, make them more owners of the problem. So with that, these are the people I'd like to thank, who are collaborators on this project, and I'm happy to take any questions soon.